My name is Mike Plunkett. I'm the dental director for CareOregon Community Health. I came on in March, and what we're doing here is setting up a dental van, a mobile dental unit, to provide care to the clients of the Canby Center, which is a nonprofit located in Canby. And that is not as simple as it might sound, mainly because dental requires a tremendous amount of instruments, supplies, very specific space, appropriate space. The chairs you see here, they're very specific to dental. The lights, all the equipment, the x-ray units we need for every single case, because most of the things we'll be doing here are very problem focused and problem specific, and you need an x-ray to determine what needs to be done. So there's a lot that goes into dental and developing a dental program that it's not necessarily the same with a medical outreach or medical program, just because of all the instruments needed. Yeah, another thing about Canby that surprises people is the number of homeless. You have the migrant worker population, you have just the uninsured and underinsured, but there's an enormous homeless population in this region. And they tend to live in a shadow world where no one knows they're there because they're not insured and they're not really on anyone's radar. They just simply exist from day to day, but they also have needs like everyone else. So one of the issues with dental care and access to dental care that's so problematic for the public is that it is expensive to deliver dental care. The office is expensive, it's equipment and supplies intensive. It takes a very confined environment and specific type of environment. This is very unique, and other dental vans or mobile units have sort of captured this ability by you lower the cost, because we can do effectively the same thing in this van or this trailer that can be done in a private office. We don't have the cost of renting, leasing a building. We certainly don't have the ability to provide daily care and develop this like a private office or like a regular community health clinic. But we can take this. There are advantages to that. There are disadvantages and advantages. The disadvantage is that it is a little more difficult to administer it like you would a regular fixed clinic, but the advantage is it's mobile. So we can do it here where the patients are, or we can go to a Head Start, we can go to an assisted living facility, we can go just about anywhere with this unit or something like it and deliver services. The real advantage with us is that it's attached to an administrative structure or a clinic group that has an invested interest in sustainability, versus many of the dental vans or mobile units. They are a bit ad hoc. They do great work, but they're volunteer based, and it's sometimes difficult to keep those going and sustainable long term, whereas this will be simply an extension of our fixed clinic that allow us to be nimble and flexible and deliver the same services, just in a more varied geographic environment. And so we will not be free, but we will be a reduced rate. And I think that's important to note, because we tend to have really two sides in dentistry: a very high cost environment that is very difficult to access, or free care that's unpredictable. And so what we're trying to do is develop something that's sustainable, where it's not free, but it certainly is a reduced cost that's more appropriate to the income and the lives of our patients. That way it allows us to have a model of care and a clinical model that's sustainable financially, but also it creates access that's sustainable at the community level.